Hi, how's it going?
Good. How are
I'm
you?
David. I'm going to be your PT for the day.
Okay.
So I've read over your information that you filled out in the waiting room, but I was just wondering if you, in your own words, could tell me a little bit about your pain.
Well, it hurts when I'm sitting here just like this, kind of
Okay.
slouched down. It hurts when I study and when I'm sitting like this.
Okay. So you're in pain right now. How would you rate that pain on a scale of 1 to 10?
Probably about a 6 right now.
You're at a 6 right now. And how would you describe that? Is it really sharp right in your back, or is it just kind of achy? Dull?
It's really achy, kind of dull feeling. It's really stiff too.
Okay. About how long has this been going on for?
Probably about 2 or 3 months.
Okay. And when it happened, was there anything specifically that happened, or did it kind of just, gradually start happening and you just kind of noticed the pain?
I just kind of started noticing it from studying and sitting like this a lot. I just noticed that I started having a lot of pain with this.
Okay. So is that pretty much the only position that puts you in any pain, or is there anything else?
Yeah, this is about the only position that hurts.
Okay. Can you get out of that position a little bit?
Oh, that feels better.
Does that make it feel a little bit better?
Mm-hmm.
Okay. Are there any other positions that you're in that make it feel a little bit better?
When I lay down and if I stretch like this or if I get up and walk around.
Okay. So throughout the course of the day, so over 24 hours, are there any periods that it hurts worse than others, like in the morning or at night?
In the morning it feels good,
Okay.
but throughout the day when I'm at school and studying it gets a little bit worse because I notice I start going more like this.
Okay. This brief exam could be the typical presentation of a patient complaining of low back pain in the clinic. However, most patients usually fill out a subjective eval form before coming in to see the PT. Here are some of the details that were gathered from this form for this patient in order to make this case scenario more applicable. First of all, the patient has complained of centralized low back pain for the past 2 months. She doesn't have a past medical history of back trauma or this type of pain that she's currently experiencing. She's a college student, she's living with a roommate, and she spends a few hours a day sitting and studying. That's where she sees most of her pain. She really wants to get back relief from PT, and she really wants to be able to study pain-free. From this situation, although we could have many hypotheses, these are our 3 primary ones thus far: lumbar segmental hypermobility, iliopsoas tightness, and sacroiliac joint dysfunction. We are going to progress through this video as if we expect lumbar segmental hypermobility to be our primary hypothesis. Now we're going to do a structural inspection of our patient. This is really going to start as soon as our patient walks in the door by assessing their posture. However, we could also include something like palpating the asiases and psiases and see how they move during flexion and extension. We could also do side bending. Don't forget that this could be similar to how you might screen somebody if you use SFMA top tier screening. Okay, so start off with, can you go ahead and find these hip bones here in the front? Can you lift the chair up a little bit? Can you turn around? We'll do the same thing on the back. Now, Chelsea, can you go ahead and bend forward and touch your toes? Okay, back up. Do you pain with that?
A little bit, yeah.
That hurts. Is it pain that I'm creating, or is it the same pain that you're having with your symptoms?
It's a familiar pain.
Okay. Can you go ahead and put your hands back here on your hips like this, and we're going to extend. Yep. Do you have any pain with that? No?
No.
Okay. Now we're going to do the 5 sacroiliac joint provocation tests in order to try to rule out the SIJ, in order to look at the bigger players such as the lumbar spine or possibly the hip. Okay, now we're going to go through the sacroiliac joint provocation algorithm, and so there's 5 tests in this. If one of them is positive, then that's going to show us that there might be something wrong, but really what we're looking for is 3 or more. So it starts off with distraction. It's going to apply a tensile load to the anterior portion of the sacrum, and you want to have your patient's legs propped up for comfort. And we're going to put our hands on the ACES and apply distraction force. How's that feel? Okay? Okay. And And the second test that we're going to do is the thigh thrust test. You're going to test this on both sides. We're going to flex the knee up to 90, apply pressure to the opposite ASIS, and give an anterior to posterior shear force to the sacrum. We do that on both sides. Okay, now we're going to do a compression test. It's going to give a lateral compression force to the SIJ joint. And you're going to put your hand on the ilium, and you're going to be pushing straight down at compression. How's that feel? Our fourth test is going to be Faber's test. And with this, you're going to stabilize the opposite ASIS, and you're going to apply posterior force down on the femur, and that's going to apply anterior tension to the SI joint. How's that feel? You do that on both sides. Okay, now we're going to slide our patient over to the edge of the bed to do Gainsland's test. Okay, can you go ahead and grab behind your knee right here? Right, we'll let this knee off the side of the table. Okay. I want you to help me push this leg towards the ground. How's that feel? Okay. I want you to help me pull this leg back towards you. How's that feel? Okay. And we would do that on both sides. Remember, for all 5 of those tests, we're looking for 3 of them in order to tell us that we can go ahead and treat the SI joint. And we're going to ask non-leading questions like, how does that feel? And you want to make sure that you do it on both sides to get an accurate assessment. Now that we've ruled out the SIJ, we can move on into active and passive range of motion. This is going to help us get a better baseline idea of how well our patient is moving, while also allowing us to look at any lumbar hyper or hypomobility, which we've postulated in our hypothesis. Okay, so we're going to show you some of the goniometric measurements for the lumbar spine. And to do this, we're going to be utilizing both a tape measure and also goniometer. So what we've done here is we've found the PSISs, and we've made a line. So that should be at the line of the S2. And then we've measured up with our tape measure 15 centimeters, which would get us to roughly T12. We can also palpate for the ribs. The bottom rib would be connected to T12, and that's another way that we could connect that. So to look at flexion, we're going to tell our patient to go ahead and bend forward and touch your toes. We can get a slight end feel from that. Should be firm. Good. Okay, stand up. All right, now we're going to use our tape measure. And so our initial measurement is going to be 15 centimeters. And whatever we get from this, we're going to take that number and subtract 15 from it, and that's going to be our range. Normal range is going to be about 6.5 centimeters on this test. Okay, Garrett, go ahead and bend forward one more time and hold it. Okay, relax. Okay, now for extension, we're going to do pretty much the same thing, except he's going to be going backwards. So we're going to instruct him to go ahead and put your hands back here on the back of your hips. And we're going to lean back. And we can get a slight overpressure if we want from that. And that should be a firm or hard end feel. Okay, relax, Garrett. And we're going to do the same thing, except the normal range for this is going to be 1.5. So we're going to take, so we should be getting a smaller number from this than we start off with. So we're going to take 15, subtract the number we get, the difference should be about 1.5 centimeters. Okay, Garrett, go ahead and do it one more time. Okay, and for our third assessment for lumbar spine, we can do side bending. So what we're going to do for this is we're going to instruct our patient to hold your hand on the back of your thigh, bend to the side, and keep your hand in contact with your thigh all the way down. Good. We can get a quick end feel from this. It should be a firm or hard end feel. Okay, here, relax. And our stationary arm for this is going to be perpendicular to the ground, and our axis is going to be on the S2 spinous process, and then our movement arm is going to go through the T12 spinous process where we've drawn our line. Okay, Garrett, go ahead and bend to your right again with your hand on your thigh. Okay, relax. And normal for this is 0 to 25 to 30 degrees. Now we're going to move into doing manual muscle testing. For this specific test, we're going to do lumbar extension, but there are many more that you could do to the lumbar spine as well as to the hip in order to determine some baseline muscular function. Okay, go ahead and lay down on your stomach really quick. So we're going to test the strength of these muscles in your back. So can I have you put your hand behind your head on top? There you go. Okay, now I'm going to have you use these muscles and try to lift your chest up off the table. Okay. Now let's try that again. Okay. Now can you put your arms down by your sides? Alright, now try lifting up off the table. Okay, relax. At this point, we might want to observe something from the hip. Something that we could do really quick is a Thomas test to determine the muscle length of the iliopsoas as well as the rectus femoris.
Alright, so now we're going to go ahead and perform the Thomas test. So if I can have you grab behind your legs, and we're just going to go ahead and lean back. If you can put both of your arms around this knee, and we'll just drop this leg down off the table. And since her thigh is touching the table, that rules out that the iliopsoas is tight. And then since this leg is flexed to 90, that rules out the rectus femoris.
Now that we've established that the Thomas test was negative, we can go ahead and do some palpation. We could do some palpation to the iliopsoas muscle in order to determine if there are any trigger points causing this patient's pain. However, we decided to go ahead and do some lumbar palpation in order to determine if we can find any hypermobile or hypomobile segments in the lumbar spine.
Hey Chelsea, is it okay if I touch your back? Okay, so I'm just feeling for some warmth, and you are pretty warm and a little bit of moisture there. So I'm just going to apply some gentle pressure, and I'm just looking for the redness. And you are turning a little red. It's taken a while to disappear. Okay, and then the next one, I'm just going to gently roll your skin. All right, so you roll pretty easily, so it looks like hypermobility.
Now that we're starting to think that this patient might have some lumbar hypermobility issues, we're going to go ahead and do a quick active straight leg raise test in order to determine if any of this pain could also be coming from weakness in the abdominal musculature.
So now what we're going to do is just a quick strain. Since you were stuck in that forward head posture, we are going to test your abs just to see the strength of them. So we're going to start with a straight leg raise. So can you just lift this leg up a little bit? Good. Do you have any pain there? Is it your pain or is it okay? Can you relax? Can you find those hip bones for me? And now what we're going to do, I'm going to have you do that again, and I'm going to come in and apply some pressure, and we're going to see if that I can possibly take that pain away. Okay, so please lift your leg up. Still pain? Yes. Does that take your pain away? Okay. Relax.
Now we're going to do a quick lumbar instability test in order to determine if there's any segmental instability in the lumbar spine.
Alright, Tori, what I want you to do is to lean over the table and just put your chest on the table. Alright, you're going to feel me put my hands on your back. Okay. The segment, we think there might be a problem. Does that reproduce your pain? Alright. Can I have you hold on here and then just lift your legs off the ground? Alright. Hold there. Any pain there? Alright. Now? No, it's gone.
Now we're going to do a flexion, extension, and side bending, PPIVM. This is going to help us determine the general mobility of certain segments while we put them through certain movements.
So next we're going to be going and testing to see the mobility of the segments of the spine. So it's important to figure out exactly which spine that which segment that you're on. So you can go and find the iliac crest, go over from there, and you can find L4. And then right below that is going to also be L5. So first we're going to go and check with flexion. And we're going to go and kind of just look for any gapping and see if one segment has more gapping than another, or if there's hyper or hypomobility. Okay. We can also go and test side bending. This, can you just scoot a little bit towards me? Thank you. We can go and bring her legs off the edge of the table. Hold it from the side here. And you can go to the sides of the spinous process and see if there's opening or closing. Another way to do this is only for the lumbar spine. You can just go right under the ischial tuberosity and go and do a forced closure on the side. Okay, you can go right back in the center of the table. So for the last one, we can come over to this side of the patient. You can go and bring the foot, place the foot right on the thigh, support the knee, and you can go and bring the leg into extension, feeling for the closure at the segments. And you can go and move up a segment or move down.
Now we are going to be applying a central posterior anterior pressure, or CPA, to the different lumbar segments. This is going to help us determine the amount of mobility and resistance to pressure, as well as the presence of pain and type of pain in the different lumbar segments. Overall, this is going to help us determine if lumbar hypermobility is something that we should try to treat for this patient.
Amanda, so the next thing we're going to do is called a PAMO, so posterior anterior mobilization. We're going to try to see if one of your vertebrae is moving a little more than the other, okay? So I'm going to just go ahead, I'm going to place my hand on your back. Find segment. Okay. So your central PA, sternal motor. Segment. I'm just going to shoot just a little bit more. All right, very good.
Here are two research articles showing that an assessment like the one you just saw could be successful in determining lumbar hypermobility or instability of a lumbar spinal segment. While we could have included some more tests, and we haven't learned all the tests yet, an assessment like this is going to be useful in the future, especially this summer during our clinicals.